The radius. The radius forms 4 joints. It is part of the elbow as the synovial hinge joint. It at the distal end, down at the very base, you've got the radiocarpal joint, which is a synovial condyle joint. That is your wrist. And then we have 2 joints that are medial to the radius. You have the proximal here, which would be at this part of the radial head, would be the proximal radio-ulnar joint, and here with the ulnar notch will be the distal radio-ulnar joint. Both of these are synovial pivot joints, which is how you pronate and supinate your forearm. We actually have 2 joints between the radius and the ulna. So a close-up on the radius, the proximal end, you have this very round head. You can actually see where this is a real bone and has been slightly broken on the head, where the compact or dense bone has, which I said was thin as an eggshell. Well, we cracked it, somebody cracked it off, and you can actually see the spongy bone on the inside of the head. And then the other landmark we really look at for the radius is this huge radial tuberosity. That is the attachment point of biceps brachii in the radius, and biceps pulls on the bone, creating this bump. At the distal end of the radius, you have the ulnar notch here, which is which is where the head of the ulna fits, the smooth anterior surface of the radius. And then we have this point here. It's called the styloid process. And we say that it's the styloid process of the radius because we have other styloid processes. So this one is specific to the radius. And the carpal surface is the inferior surface of the radius, where it makes that wrist joint. If I turn the radius over, so we have the distal posterior, the key is the anterior was smooth, but the distal edge has all these ridges on it, which are created by the tendons that go past, and they create grooves in the bone. I gave this other view of the styloid process so you can see just how much of a point it comes to. How do you tell right from left radius? Well, the head is proximal. That's fairly easy to find. And the styloid process is lateral because you find the styloid process on your own wrist by feeling for that large lump of bone right next to you at the base of your thumb on the actual radius, just past the wrist, proximal to the wrist. So you can feel that styloid process, and it is lateral. And then the anterior surface is very smooth. Here's the ulna. So the ulna forms 3 joints. It has the elbow joint, which we've gone over, and then the 2 radio-ulnar joints. It is important to note that the ulna does not form a joint with the carpal bones at the wrist. It only forms a joint with the radius at the wrist. That is so that the radius can roll and cause that pronation, supination. The landmarks of the ulna anteriorly are the trochlear notch, which is what makes it look like a wrench. That fits to the trochlea of the humerus. The coronoid process, which is a point that sticks out anteriorly. When you flex your elbow, that coronoid process goes into the coronoid fossa. The radial notch is key. It is to the side laterally to the trochlear notch. It's about the size of your thumbnail. You want to find that because that's how what you are going to use to be able to tell right from left ulna. Inferior to the coronoid process is that ridge of bone that is the ulnar tuberosity. And at the distal end, we find the head of the ulna. Taking a close-up of the ulna proximal end, on the posterior is the structure known as the olecranon. The olecranon is the point of the elbow that you feel. If you flex your elbow, because remember it's flexion extension, if you flex your elbow and you feel the point of your elbow, that is your olecranon. If we look at the anterior, this is a better close-up of the trochlear notch, the coronoid process, and the ulnar tuberosity. And once again, you can see this structure of the radial notch here. The distal end, I pointed out the head. The ulna is one of the few bones that has the head at the distal end. There are a few others, but this is one of the few. And we have a styloid process of the ulna. And if you turn the bone so that you're kind of looking at the bone laterally, it makes the ulna distal end look like a little high-heeled shoe. So that styloid process is this little tiny bump, and you can actually feel your own styloid process if you go to the base of your pinky finger, your fifth digit, and you go proximal to the wrist, you will feel a lump of bone. That is your styloid process of the ulna. How do you tell right from left ulna? Now, I've turned these bones so that you're looking a little bit at the lateral surface, because the way to tell right from left ulna is the olecranon is proximal, the trochlear notch is anterior, but the real key to this is this radial notch here and here must face laterally. I mentioned before it's about the size of your thumbnail. It points at the thumb because the radius is lateral to the ulna. The ulna is the medial bone of the forearm. So you can see this here and you figure it out by looking at the radial notch. So be able to find that. The wrist and the hand. So the key with the wrist and the hand, this is a plastic model of the wrist and the hand. The key to this is we number the digits 1 through 5, starting with your thumb. Your thumb is digit 1. We start laterally, and then 2, 3, 4, 5. When we look at this, when we identify the bones, we will identify them by their digit number. So this is another photo of a real hand. It's the left hand versus the other one was the right hand. You'll notice that the distal phalange here is missing. But otherwise, it is a fairly complete model, and I thought you deserved a picture of a real hand. So how do we number these bones? This slide is available for you to look at in the PowerPoint slide, so take some time with this slide. We number the bones 1 through 5. So the first group, if we think about starting from the wrist, going out to the hands, we have the carpal bones. You do not have to know the individual names of the individual bones, but as a group, they are the carpal bones. And then the metacarpals. The metacarpals are the long bones of your hand. Think about the palm of your hand is actually these long bones of the metacarpals. Again, we number them 1 through 5, starting with the thumb. So if I were to ask you, say, what is this bone right here? You would tell me it is the third metacarpal or metacarpal number 3. Both are valid. And then when we get to the fingers, we call them the phalanges, and you've got 14 of them because the thumb only has 2. So we start with the ones closest to the hands are the proximal phalanges, and then the ones in the middle, which the thumb doesn't have, are the middle phalanges, and then on the ends we have the distal phalanges. So for instance, if I were asking you, what is this bone? You would identify it as the middle phalange, number 2, or you would say the second middle phalange. So you have to identify the bones by position, name, and number. So all of that counts.